Welcome to another brainboost video on biofeedback, and in this video in specific we will talk about the heart rate HRV. So we will explain to you how to apply the sensors, what sort of measurements are out there, how you can interpret the data, and how you can apply it into your therapy to help clients and patients as well. So in this video we are going to talk about the heart rate in specific, how many beats per minute, in what situations make sense or doesn't make sense. We will talk about the HRV, so the difference between heart rate and the heart rate variability, and how this regulation can influence your well-being in a positive or negative manner. And we are also going to talk about patterns of heart rate behavior, so what causes a steady heart rate, what causes a decrease of heart rate, so what situations, what training, in what situations does it make sense, in what situations does it not make sense, how you get your heart rate up. Well, if it helps you or doesn't help you, that is the question, to get your heart rate up or down. So we will talk about that. But we will also talk about your heart rate, what certain events or what certain behaviors or maybe nutrition will cause your heart rate to dramatically increase. And also behind that we will talk about the phenomenon of a slower decreasing heart rate, so and also what time you should keep in mind to influence the heart rate. Also we will talk about HRV, so the heart rate variability and how it is interpreted, what values are normal, what values should be considered maybe worth training, or which values in what situations make sense. And obviously we will talk about your heart rate and heart rate variability, who can benefit from a training, and on what circumstances you might want to be careful, or at least maybe look for different patterns or other biofeedback or neurofeedback protocols that make maybe more sense. So exclusively for our brainboost community, we will explain in a longer video how to use biofeedback and in specific heart rate and HRV.